supplying it, right? So this is 1, this is 2. So at this point, these two
Good
blood
morning, sir.
vessels, good morning. At this point, these two blood vessels, they meet. Now,
Sir,
there is,
sir,
हाँ, हाँ बोलो.
sir, can you explain again? There was network issue in between.
Okay. So
I'm really
this is,
sorry.
no problem. This is like a blood supply, in the normal blood supply. But when you have got one extra artery, which is like a backup system, so that is also supplying the region, but mainly it is because of this. Now, say for example, when we talk about heart, so in case of heart, there is coronary circulation, right? It is called as the coronary circulation. Very broadly, if you see, so then there is a left side, there is a right side. In right side, there is right coronary artery. This is the main coronary artery. There is left coronary artery, which is also called as the widowmaker, because it supplies those important regions like left ventricle and the septum, right? Interventricular septum. But there is one another which will be going back. It will wind around, and that's why it is also called as the circumflex artery. Left circumflex, because it winds around. But then as it goes below, and then there is these arteries, they communicate with each other. This is what is called as the anastomosis. Anastomosis is like in case if this artery is blocked, so then there is another path by which you can get the blood supply. Definitely there will be a difference between the main blood supply and this backup path, right? Backup path cannot really replace the original supply, but at least it will be enough for the survival. This is what really happens when you exercise, right? When you exercise, these blood vessels, these anastomosis, they are very delicate, very small. But when you exercise, the amount of blood which is rushing into these systems, that is so high that these anastomosis, they become prominent. When they become prominent, so that means they are capable of supplying the blood in case of emergency, whenever there is any of the issue. So that is what is called.
Excuse me, sir.
Yes, yes, please.
I could not attend the last lecture on Saturday. Could you, like, in short,
No,
tell me?
you are not the only one, because there were many students who were not attended. So that's why we'll be going for the quick revision of what we did last time.
All right.
Sir,
Thank you, sir.
But today we'll be completing this topic of joints. Right? We start in just 2 minutes.
sir,
Hmm?
sir, another doubt I have.
हाँ बोलो.
Explain medial and lateral plane with respect to brain.
Why
Sir,
this question popped up?
sir, because I did not understand it from the last session.
It has got nothing to do with brain, dear. This is the midline. Whether you say with respect to heart, or you say with respect to brain, or with respect to liver, kidney, spleen, doesn't matter. Wherever the organ is, this is the brain. If there are two systems, right? If there is a cingulate gyre, or forget about the parts of the brain, this is one part, one nucleus of the brain, and this is second nucleus of the brain. Let's name it as 1 and 2. So medial lateral is always relative, right? The structure which is near to the midline, that is medial. The structure which is relatively far from the midline, it is called as lateral. So in this case, we'll be calling it, this is lateral, and this one is medial. But if there is a third structure, let's say ear, right? Ear is absolutely outside. So the ears, they will be the lateral most structure, because after ear, there is nothing. Got it? So
Yes, sir.
medial and lateral, the difference lies only when it comes to hand. Bus. That is important. When it comes to hand, to this
Middle
long
finger.
finger, that is the midline. You have to consider this finger as the midline. Bus.
Okay. And sir, you also said that one is lateral to two or medial to two, something like that. So also explain those things.
Again, what is means, I mean, what I said is lateral and medial, they are the relative term. They are relative term. We are always comparing the things. Say, for example, sorry, I don't know, there is some issue. So this is midline. Right? Just consider midline. This is So there is one structure here, one structure here. We call this as A and this is B. So we say that B is lateral, correct? And A is medial, correct? Can B be medial? Can B become medial?
If there is
If
another
there is
structure
another
lateral,
Super.
lateral one.
There is another structure which is more lateral to it. So in that case, when you are comparing these two, so then B is lateral. But when you are comparing these two, so then this one would become lateral and this one will become, that is B will become medial. Right? It is always a relative term. When we say, and this thing will be applicable everywhere when you're talking about medial lateral, when you're talking uh, upper lower, when you're talking about superior inferior, if anything, it is always relative to each other. Some issue, I don't know why it is happening. Chalo, let's start with our today's topic. So we'll be going with the first we'll be going with what we did last time. There is some API problem.
Sir, I'm unable to see the lectures PDF from 2nd August.
From 2nd August, only the last, this one is not uploaded. Otherwise, rest all of them are there.
I had emailed you, so can you please send me the link of that?
If you are, it has to be the same link. No? It has to be this, it will be the same link what you have got. Anyway, send a mail. I'll send the link again. No worries. But if you are
Yes,
watching
I had
all the
sent you.
PDFs which are before that, let me check. But I know it is there. Because see, otherwise the complaint would have come from everyone. Joint PDF, it was not. It is not there. This last one. This one.
yes, sir.
Yes, sir.
Otherwise all of them. You have to open. I'm sorry, what you are writing? I'm unable to open the PPT.
Yes, sir.
PPT is not opening. Is it the problem with everyone or
No,
just
sir.
No, sir, it's working.
it's working?
Yes, sir.
Yes, sir, it's working.
So I think just check it because
I had opened it, sir, but it's not showing that.
it's not showing anything.
It shows the lectures before 2nd August. After that, no PDF are showing there.
Are you checking it into general anatomy folder?
Yes, sir.
See, all of them are there. Right? Just open it in VMAP. And it is this one. Then regarding the books, they are there. There was super reading session that is also there. This one.
So all are there.
Just refresh it. There must be some issue. I don't deny that. But okay, you send the screenshot. I'll just check it.
Good morning, sir.
Good morning.
Good morning, sir.
Good morning. Saad Inamdar, right? Saad, the folder which you have shown is, you should know, right? That folder. But just refresh it, because just below it is showing something went wrong. Try again. Just try it. Or do one thing. Click the link again. Just exit from this and click the link again. It should not happen, because if it's a problem over here, so then it must be the problem with everyone.
So I also have same problem. I tried so much time, but it can't be open.
Surprising.
Me too, sir.
So are you trying to open from laptop or phone?
Not the phone.
Phone.
Sir, mine is
Both is not working. I had tried from both.
It's opening on phone also.
Yes, sir. Sir, probably after refreshing should.
Yeah, should try after refresh. There is no storage issue, Abhijit. If it is the storage issue, right, then file won't be uploaded. Right?
So the issue might be on their device, I guess.
No, on their side. But if they are opening from web, maybe they can check it. That's right. They can check it.
Device, maybe device. I tried with tab, it is not opening. With mobile, it is opening.
Oh, really? कोई बात नहीं, मतलब एक बार फिर से ट्राई करके देखना, because it is important that because you should or you must get these PDFs, otherwise it becomes a bit difficult. And in case if the problem is persisting to more than 3 or 4 students, we can figure out some solution. Maybe something like, I do have other storages also like Mega, etc. So we can even shift to Mega. But this is so convenient that giving the rights, etc. is so convenient. Chalo, let's start with our today's session. This is joint. We are talking about the joints. So in Greek and Latin, Greek, it is called as the arthros, and in Latin, it is articulatio or junctura. Right? So that is the meaning. And these are the words which we'll be using very frequently as we proceed. Syndesmology, whenever the word syndesmo comes, that means we are talking about joints as well as ligaments, both the things, not only the joints. Logy is science. So it is a science of joints and ligaments. Movable, immovable, that means there'll be certain joints where there will be movement, in fact many of them, but there would be certain joints in which there won't be any movement, right? And say for example, one example is the fontanelli. As you know it very well, that's the skull as you watch from the top, right? So over there, this is in case of fetus, newborn, right, where this area is devoid of bone. It is just covered with a very thin plate of cartilage, which is very soft. And these openings, they are called as the fontanelli. There is anterior fontanelli, there is posterior fontanelli. Right? So they are there. Never to palpate, because immediately just underneath the brain is there, and chances of damaging the brain, they are very high, because as such the structure is very delicate. And another important thing is that you won't be getting any piece of information by palpating it. I mean, why to palpate? You won't be getting any clinical sign symptom from palpating it. So that's why it should never be touched.
Sir, palpate means?
Palpation means, say, for example, this is the hand touching and feeling, right? Inspection, palpation, percussion, and auscultation. Inspection is just watch. Palpation is touch. Percussion is tap. And auscultation is just put the stethoscope and try to listen. Right? So these are the 4 clinical investigations, and which is to be followed in this order, especially when you are taking the history, more when we'll be discussing the medicine or when we'll be discussing any of the pathology, right? Because we'll be discussing many of the pathologies along with the anatomy. So here is the classification: structural, functional, regional, and as per the number of bones. Initial classifications are very easy. Structural as per formation. We'll just have a look at it. Functional means whether there is any movement or not. So no movement, that is one type of joint. In which there will be slight movement, that is second type of joint. And third one, where the joint is freely movable. Very easy, very basic, very simple. Right? So that is what is called as a function. Function of joint is to move. So what type of movement it is doing? Less, more, or absolutely more. Right? Then comes the regional. Again, this is also very, very easy. Just all the ways. Regions, whether it is joints, whether it is skull, vertebra, limbs, etc. Right? So that's how it goes. Then classification as per the number of bones, whether we are talking about just two bones, right? Simple, Sida, Sada, a joint in which there are two bones. So that is called as the simple, in which there are more than two bones. So for example, wrist, then that is called as the compound joint, right? Because there will be multiple axes on which things would be working. And then finally, one more thing, which is called as the complex joint. Complex means there is a presence of disc which is inside. This is something which we'll be watching in case of synovial joint. So for example, knee joint, which we'll be discussing today. So in that, there is one bone, there is one second bone, but in between, there is a disc, right? Articular disc. The bones, they are wrapped up, as if the bones are wrapped up into a specific cartilage, right? So that there is no friction, right? We want to avoid the friction more, as we see, but it is it is inside the joint, right? The thing is, it is inside the joint. Durvank. Yes, Durvank. After the lecture, I'll send you the link. So moving on to the structural, this is very crucial: fibrous, cartilaginous, and synovial. Now, in our previous lectures, we discussed about various types of, say, cartilages, right? But first, over here, we want to see the structure. Is it fibrous? Is it cartilage? Or is it synovial? Synovial will be our main topic for today. Fibrous means it is joined by fibrous tissue. Joined by fibrous tissue. This is one, right? So fibrous tissues, they are tough structure. They cannot expand. They cannot collapse. Right? They are just tough structure. They just hold those two bones properly, and that is needed. So over here, there are immovable, right? Because see, fibrous tissue, so they are immovable. Now, when they are immovable, let's see some of the joints which are immovable. The first one which comes into our picture is sutures, right? Wait, I'll answer all these. No. Same folder, same link has been given to everyone. But still, if there is issue, now I'll send the link again. Right? I'll send that link again today. Yes, I've seen all the reports, and this is a common answer because there were almost 14, 15 emails regarding the D3 and B12. Please take care of this. If the B12 is in the range of 200 to 300, right? Start with 1500 mcg per day. This is for B12, right? This is for B12. Second, D3, if it is less than 20, so then take 60,000 IU cholecalciferol once a week. And yeah, I saw that. I saw that. In your case, even the hemoglobin was in the range of 10, which is very less. Right? It is very less. So should take iron supplements or eat green veggies, then also it is pretty good. So this is immovable joint. Sutures means they are in skull, right? And the fontanelles, they close by 18 months. Then comes syndesmosis. Syndesmosis, that is between two bones, right? Between two bones. So this is what we'll see. Say, for example, here it is the tibia, here is the fibula, and in between there is a fibrous tissue. This one, right? So tibia, fibula. In between there is fibrous tissue. There is no movement. It is a fibrous tissue which is connecting both of them. It is keeping both of them together. Similarly, in case of radius ulna, right? Those fibrous tissues, they are making the complete sheet. And that is what is called as, because it is interosseous between two bones, ligament, because it is bone to bone, but it is like a sheet. It is connecting both the bones. We'll study this thing in more detail as we'll go for anatomy, because there'll be multiple structures at different level which will be passing through this interosseous sheath. Because you can understand one thing, when we said that upper limb, it is like 2D, right? Upper limb is like 2D. This is the front, this is the back, right? So there is anterior, there is posterior. But who is dividing it? It is the interosseous ligament. Interosseous ligament is like a wall, right? So एक side anterior, एक side posterior. So when the structures from posterior side, they will be coming to anterior side, they'll be piercing this interosseous membrane. As such, it is like a safety mechanism, because if it is associated with bone and when the bone moves, so it might lead to some injury. Though some nerves and some arteries, they literally grew through the bone, right? So there'll be the radial groove. So yes, wonderful radial groove. It's a tunnel through which the structure will be passing. It gives good protection. But if the bone breaks, so those vessels, they also break. They lead to bleeding and so many complications. Right? So this is why anatomy is important, because if you understand anatomy properly, you'll be able to understand surgery very well. Right? You'll be able to understand surgery very well. All right. Moving on to this gomphosis. Gomphosis is when we are talking about the gums, right? So in this, gums, they are there and the tooth is inserted, right? So this is called as the peg and socket. Peg and socket is when we play golf. So in that case, that is called as the peg. Iske upar fir ball lag ke, then it is hit. So this is like they are holding those gums, they are holding those teeth, right? So tooth, it is inserted into the gums like this. As sutures are important. Yes. Go ahead.
Interosseous ligament is a type of syndesmosis.
Yes.
So, but you said that these joints are immovable. But when we in upper limb between radius and ulna, there is this presence of interosseous ligament. When we move it, this joint also moves, right? You said that it pierces through it.
The movements which are occurring, right? You'll find that those movements, either they are occurring from proximal end or the distal end. In between, there is no movement. Right? Those interosseous ligament, it will always stay in between both of them. Right? Its function is just to hold both of them. Right? There will be relative movement, but the whole thing will move. Actually, when you move the wrist, when you move the elbow, so then the elbow, those bones, they are coming into picture for the movement. But those interosseous in between ligaments, so they are keeping the structures intact. Right? More, it's a good question. In fact, we'll be discussing this particular point, what you said. I think within, say, 15 minutes, that point will come, right? What is called as the conjoint and disjunct and adjunct. We'll just come to that.
Sir?
Okay. Yes.
What is interosseous ligament also present between radius and ulna?
Yeah. It is between radius ulna, it is between tibia fibula. That's right. Radius ulnar, radio ulnar. It is also called as the radio ulnar ligament. Right? Simple. Interosseous.
Okay, sir.
So now we move on to the suture. Suture, which we said till this point of time that it is just one joint into the skull, but there are various types. One type, which is called as the plain type. Plain type, in which this is one bone, this is second bone. So just like straight, flat, right? Flat line. When we'll be dissecting the skull, then we'll find that this nasal bone, so it is straight. There is no rough margins, absolutely straight, clean line. And that is what is called as the plain suture, right? This is internasal suture. Whenever we'll be talking about suture, there will be like one outer plate and the inner plate. Two plates are there, right? Two plates. So this is the sutural membrane, which is at 90 degrees, right? Straight. So that's how those bones. This is one bone, and then there is outer plate, inner plate, outer plate, inner plate, and then they are connected with each other. The second type of suture, which is from the shape, sirat. Sirat means notch, churi ki tarah, right? Ragged margin. It has got the ragged margin. So interparietal sutures, they are like that. Interparietal means that is the sagittal suture. Just have a look, right? Here it is, right? This is one parietal bone. This is the second parietal bone. One parietal, second parietal, and in between it is the interparietal suture. This, right? So that is interparietal suture because this is the axis. So we also call it a sag suture or the sagittal suture. Right? So that is one. The third type. So this is the first one. This is the first one. That's the second type. And now comes the squamous. Squamous also means flat. Right? Squamous cell epithelium means this is like squamous cell epithelium. They are like flat. So here they are flat, but as we said that there is outer and then there is inner one, right? Inner plates. But they are connected by the sutural membrane. It is oblique, right? This is oblique. Will there be any change from the looks wise? No, right? These are all detailed things. When you got skull in your hand, they both look similar. Yeah. What's the importance? When there is impact, right? When there is impact, so then in what direction the impact is, which leads to break of skull to that point, right? So this is what we'll be learning when we'll be discussing skull injuries. Right? Why they say that helmet is important, but which part of the helmet should be important? Why this part? Right? Even if you'll see the helmets, that part is very important. So that's how the things they really go. So this is temporoparietal, right? Remember temporoparietal. Where is the temple? Temple, ears, right? So that is the temporal bone. Parietal, this, right? So temporoparietal. So you got the idea that when you this haircut, your haircut is temporoparietal, right? Let's see that. For that, we have to see the skull from the side, right? So this is ear, right? This is the ear, right? External auditory meatus. So that's the ear, and this one is the temporal bone. This one, that is the parietal bone. So this particular line, which is marked, right? Let it remain, right? So this particular line, this one, right? So that is the temporoparietal suture between temporal and parietal. Easy. So that is squamous. That means it is flat. The fourth type of suture, this is the fourth type, which is called as the denticulate. Denticulate matlab daat ki tarf, right? Daat. This is like a denticulate. So here it is wedge over here. The denticulate. This is the structure, right? This is the structure how it goes. So lambdoid suture. Lambdoid suture is like that. Where is lambdoid? For that, we need to see the skull on the posterior aspect. That's the lambdoid suture, right? That's the lambdoid suture. So this lambdoid suture is between this bone and this bone. So we need to figure out which bones are there. So this one would be the. That's right. This one is the parietal, and this back side, that is
Occipital.
Occipital.
That's right. It is occipital. And in occipital, you'll find that these are the ridges. Right? These are called as the external occipital protuberance. Protuberance. They are protruding. Right? So because external occipital protuberance. So there is superior, middle, inferior. Correct? Now we said that external, so that means if we cut the skull and we watch inside, so yes, there'll be inside also such prominences. Right? So that's how it goes. These are the lines which are present. Superior, middle, inferior. But inside also it is there. So that's why this is giving you the hint that there'll be internal occipital protuberances also. Right? This is just to enhance that fact that whenever the name is given, if there is superior to, then remember there must be inferior structure also, right? Otherwise, if it is not there, then we would have said just occipital protuberance, right? Why? Because there is nothing like external or internal. Okay, one question to everyone. I just got a coin. That coin is made up of silver, genuine silver. On that, there is, right? It seems like an antique coin. Antique coin. And over here, there was that Purane Raja jo the, right? So that structure was there. And it was over here, it was written 1901 to 1907, right? And it was like King Edward I, 1901 to 1907, and India. So all these things, they were on the coin, right? Over here, right? And on the opposite side, shape and everything was there. So I was happy. Ki, chalo yaar, coin mila, silver coin. As such, silver is so costly. Let's sell this coin as an antique coin into the philatelic bureau. So philatelic bureau, right? That is where you can really sell, or you get the value of your coin. When I went over there, right, without testing anything, that guy, he said, this is 20 grams of silver, so I'll pay you the cost of 20 grams of silver. This coin is fake. I said, just test it. He said, no need. This is a fake coin, right? So you get the price only for that 20 gram silver, not the antique value. How was he able to say this? There is something
groove markings.
There is something what is called as the lateral thinking, right? Gradually, I'll keep on asking you some questions, and someone reminded me for that homework.
So there should be like something a landmark in the coin unique type which we say
So whatever the design which you wish ki yahan pe there should be the grooves. So grooves were there. Spelling was not wrong, right? India की जगह भारत लिखना हो या जो लिखना हो आप बोलो, right? On the opposite side also there was.
But the name should be King Edward the Seventh.
No.
He was not King Edward the First.
He was there definitely, and this is also right.
No, sir. It should not be 1. It should be 7.
Why 7?
Because there were 7 King Edwards.
So what? When King Edward I was there, coins were not released? Definitely released.
No, but not in India, sir.
In India, there is a coin. There is a coin. And in fact, I do have coin. I am a coin collector.
Okay, sir.
Sir, the weight of silver must be less.
Weight is perfect. Perfect weight. Perfect weight. No problem in the weight.
Sir, more other materials will be there in more amount.
There were pure silver coins. Pakka.
Sir, pure silver coins have that layer, na patina. Maybe this coin does not have it.
No, it is. That was also there. Chalo, I'll disclose it because otherwise we'll be spending so much time on this. The idea is, this is the cause. King Edward I, how on earth he was going to know that there would be someone called as King Edward II? There would be another King Edward after me. How he'll know? He'll always be like King Edward. Say, for example, when the movie came, Superman, it was just Superman. It was not Superman 1, it was Superman. Then came Superman 2, Superman 3. Jurassic Park, it was just Jurassic Park. It was never Jurassic Park 1. When the Jurassic Park 2 came, it said Jurassic Park 2. Right? Dhoom, our Indian movie, Dhoom. It was just Dhoom. But then came Dhoom 2, Dhoom 3, right? All those. So whenever it is first, it will never ever be written as 1. It will always be written as just the name, never 1. Right? So that is the thing. So this is what is called as the lateral thinking. So I used to take those IAS lectures. There is Sardar Patel Institute of Public Administration. So I have got a huge collection of such questions. So this develops what is called as the lateral thinking. So we'll be discussing several such questions, right? Every day we can have one, but these questions, they will be very helpful when you'll be studying or even you'll be diagnosing many of the condition, because you will be able to think out of the box, right? Out of the box. Out of the box means there is one thing what is called as the conventional thinking, when everyone will be thinking like that. So, and then there is another method by which you are thinking from other angle. Coming back, yes. The last one, which is called as the shindialysis. So this is the fourth, and this one is the fifth one. Shindialysis. Shindialysis is wedge and groove. There is one bone like that. There is another bone also, as if it is wedged into it, and vomer bones, sphenoid bone, palatal, maxillary, all these bones. Palatal means that palate, hard palate, right, where your tongue can touch. Palate and maxilla. Now these are all sutures which are inside, right? So when we'll be discussing inside of the skull, we'll have a look at it. But at this point of time, just remember that there is one bone, right? There is one bone, and other bone is as if it is wedged, as if it has penetrated into that bone, and that type of sutures they are making. Functional point of view, all of them, they are immobile, right? So this is just for clinically. Is there any importance? Yes, when it goes for fracture. Some sutures are more powerful, some sutures are less powerful, right? And it is important to know such sutures, because when you'll be looking at the X-ray, some sutures, they look like a fracture, but they are not fractures. So to differentiate between a fracture and a suture, that is one of the important concepts which we'll study when we'll be discussing the radiology of skull. Now you know this part, right? This is also known to you, parietal temporal occipital. You know this part. This is lambdoid suture, that also we have discussed. So till this point of time, classification, it is structural, functional, regional, and as per number of bones. In case of structural, we talked about fibrous. We talked now, and in fibrous there was sutures, syndesmosis, and gomphosis, right? And in sutures, it is like plain, serrate, squamous, denticulate, and shindialysis in shindialysis, which is like wedge and groove. On to this part, that is the cartilage part. We are now on to this cartilaginous part. In cartilage, we know that there are three types of cartilages, right? Out of which, say, first type of cartilage, which is called as the hyaline cartilage. Hyaline means halos. Halos means translucent, right? Like a butter paper. So this is cartilage. There are two types, primary and secondary. Primary means it is temporary because it is laying down the structure of the skeleton. And then gradually it becomes bigger and then it ossifies. When it ossifies, so it is a full-fledged complete structure. But beginning has to be temporary. So these are called as the primary cartilage. So that is what is called as the temporary cartilaginous joints. When we are dealing with such, the cartilage will be hyaline. So that is synchondrosis. Synchondrosis. Chondros means cartilage. So this is synchondrosis, in which the structure is of hyaline cartilage, which will then be converted into bones, and then we'll be calling synostosis. Ostosis means bone. So that synchondrosis, it get ossifies into bone, and that is called as the synostosis. Where do we see this thing? One, very logical, epiphyseal plates. Epiphyseal plate means those are the growing ends, right? This is the growth plate. This is the growth plate. This is the plate from where the bone will keep on growing, right? At one point of time, when the height is sufficient, right, it is these hormones, right, they will lead to blockage, right? They will lead to ossification, and then the growth plate stops. Right? So done. So that is the synostosis has occurred. Say, for example, it is said that why the height of females, they are usually less. So it is the effect of estrogen. The estrogens, right, they will stop that height. So thus it has definitely direct proportional to to increase or decrease of the height. In fact, it is true for everyone. Right? There is certain age till when the height increases. So any of the stretching exercise, any of the powerful exercises done at that point, it will really build the structure. Once the structure is finalized, once the synostosis has occurred, then there is no scope. Right? Growth plate won't occur again. It won't occur again. So that is the thing. Then spheno-occipital, sphenoid and occipital. Occipital, so we understand where is the sphenoid bone. Sphenoid bone is inside, right? Sphenoid bone is inside. So that is what we'll discuss. And third one, the chondrosternal or the sternocostal. First chondrosternal, that means the sternum, and over here the first rib, right? So you can imagine. Right? So this is the sternum, and the first rib is coming. So that's why we'll be calling this joint as the chondrosternal or the sternocostal. So this is the sternum and this is the costa. Costa is rib, or the initial part. Initial part is cartilage, correct? It is cartilage. So that's why we can also call it chondrosternal. So this is the first one. Why first? Because this will ossify. Others will remain as a cartilage. This will ossify because we want a very proper thoracic inlet, right? So that's why you'll be able to trace the first rib all the way from the posterior to the anterior part. You'll be able to see it. Right? So this is what is called as the first chondrosternal. The second part, the secondary cartilage. So these are called as the fibrocartilage. These are called as the fibrocartilage. Though there is some hyaline also, but basically they are the fibrocartilage. They are called as the symphysis. Symphysis is where they meet. So where exactly? Symphysis, which is meant for strength. So first is symphysis pubis. That is when both the hip bones, they meet in the front. So that is what is called as the symphysis pubis. That means there would be fibrocartilage. Fibrocartilage is giving powerful strength, right? Because it is on that strength the entire body is standing. Then see all these areas here. Manubriosternal joint, manubrium and sternum, right? So this is the manubrium and the sternum. It is this joint which we are talking about. This is the also called as the angle of
Louis.
correct, angle of Louis. And this is the angle which is very important, as so many thoracic structures they'll be making changes at this level. Very good. The third one is very practical. It is intervertebral disc. So in between the vertebra there is a disc, and that disc is fibrocartilage. So it is a tough structure. If we watch, we remove the one rib, and when we see that this is the structure, but in between there is a very soft area, and that area is called as the nucleus pulposus, right? Pulposus. Nucleus pulposus is soft. So we'll be taking this point into consideration. It is soft because of the presence of water. So that's why we'll watch this when we'll be watching the MRI, right? T1 weighted, T2 weighted, and we'll see that how it really looks like. Okay. So let it remain. Clover, radish, alfalfa, and fenugreek. So these are some very good seeds. These are some very good seeds which can be used for sprouts. And it costs 5 to 7 rupees a day. And it is a very good quality of protein. Right? You can have sprouts. Okay, on to now synovial joint. So in synovial joint, important is that there is hyaline cartilage, right? Which is our articular cartilage. Now this cartilage, we discussed during our discussion of cartilage that there is no blood supply, there is no nerve supply. So the pain, there is no pain, even if we cut the cartilage. There is no blood supply because they get the nutrition via diffusion. That's right. So this will be the salient feature of our synovial joint. One, the cartilage is hyaline, The second, there is synovial fluid. Synovial fluid, because this is like a gearbox, that fluid is filled in. This fluid's responsibility will be to give nutrition, and second is the lubrication. So that's why कई बार they say कि joint में पानी कम हो गया है. It is this thing. It is this synovial fluid when it is decreased. So that means there will be less of the lubrication when the bones will be rubbing against each other. Bones, they are periosteum that is very rich with nerve supply, so that would be very painful, right? And when the nutrition is damaged, so that means the proper ossification and proper, because bone is not a dead structure, bone is a living structure, so it would start affecting that. When the D3 level is less, when the calcium is less, so this means what? Everything is fine, but the raw material is not present. So if the raw material is not present, then how the bone can really synthesize? B12, why it is important? Because B12 has got one of the important function of neuromuscular coordination. So the brain tells, okay, do this function, right? But then if the muscles are not responding properly, because the signal from brain has not reached to the muscle, because everything is going via those synapses when now to now to now they are joining, and in between, correct, there is neurotransmitters. So B12 plays a major role into that. Now here it is, the third and important point which is present in classical this is intra-articular disc. There is a disc between the joint. So here is what, this is a femur, this is tibia, right? There is already articular cartilage. There is already articular cartilage, but on top of it, there is intra-articular disc. This is extra. This is extra. This is the extra protection. It is giving the cushion effect, right? And then this particular joint, it is packed, right? It is packed. So this is called as the capsule.
Fibrous capsule.
Yes, fibrous capsule, right? And then this whole thing is filled with fluid, synovial fluid. This whole thing is fluid. Can you take this fluid out? You can, but why do you want to take this fluid out? Dhruvi, if the screen is unclear,
No,
then
sir, it's
there
clear
is.
now. It was in the starting, it wasn't clear.
At the starting, it was okay. Okay. Is anatomy all about memorizing, not about conceptual? Sakshi, if someone is telling that anatomy is about memorization and not about conceptual understanding, so then what are we doing? Anatomy is purely about conceptual understanding. Once you understand it, right? Because see, memorize, so you can memorize very easily that okay, vomer is this type of plane, and then say sphenoid-occipital is this type of joint. When it comes to, if you are not knowing that what type of joints they are, what type of structures, because if you know that it is already the structure is like this, right? So then on X-ray, when you see that structure, you won't be confused. But if you try to just cram it, then it is difficult. Why people really say that, I'm not denying, right? What you heard is that is true. If you don't study right from the beginning, but last में क्या होगा? There would be so much of pressure. इतना pressure that then it happens like छोड़ो यार समझना, मारो रट्टा. Right? Who is asking us in so much detail in exam? So that is what really happens. That's why most of the people, they fail in viva of anatomy. Theory में normally people don't fail. वो तो लिख दिया, active passive करके गोल गोल घुमा के लिख भी दिया. But when it comes to viva, bone सामने पड़ा है, and when the teacher tells that pick up the bone which you have prepared the best. Now that is a googly. Because whatever the bone which you pick up, so that means now he can ask any question on that, because you said that yes, this is the bone which I prepared the best. Right? So anatomy is, and in anatomy you can do the maximum cheating. Maximum. Kyun? They won't say that keep all of your bones outside and then come to the examination hall. Right? If you are supposed to write anything, so you can always palpate कि हाँ, this is the bone, यहाँ से nerve गई. Remember it like this, right? And लिखो. They can't say no. You know? So yeah, I used to write paper like that. Literally like this. ऐसे करके अच्छा हाँ यहाँ दर्द हुआ तो यहाँ पे ये nerve थी. Because पढ़े इस तरह थे. So even when we'll be studying upper limb, I'll tell you where to palpate, right? Where to palpate so that you feel यहाँ पे I'll say कि मारो अपना हाथ पीछे, current लगा, ulnar nerve, right? You'll never forget. Because when in certain condition, when that nerve is enlarged and that gives so much of pain, then we understand कि ये क्या pain होगा इसका. Because when the nerve becomes like a cord, रस्सी जैसी बन जाती है nerve, रस्सी जैसी. Right? And when you just touch it, you can't palpate. You can't palpate. Palpate is this. You just touch it or patient chillaye because it is so painful. But once you have understood that, yes, हाँ जो मुझे current लगा ऐसा, so that was because of this now, you'll always remember. Okay. Then you'll come across those collateral ligaments. Collateral ligament कैसे होंगे? Collateral's function is to support. Right? To support. They can be internal, they can be external. कोई joint के अंदर होंगे, कोई joint के बाहर होंगे. And especially in knee joint, we'll come across such joints, right? Because knee joint is formed by femur and tibia and not fibula. Fibula to bahar baitha hai. Fibula is outside. It is not part of the knee joint. So entire knee joint is purely femur and tibia. So that's why there'll be tibial collateral ligament. There'll be fibular collateral ligament. Fibular collateral ligament is just for the normal support. Tibial collateral ligament is thick, stout, and it goes all the way inside and it gives solid support. And in between, we have got this meniscus. Now, meniscus आपने कई बार सुना भी होगा, especially during tennis, lawn tennis, right? In order to return that drop shot, right? भागे, all the way the leg is stressed and ball return किया and then वहीं पे बैठ गए. They just sit over there. And then what happens? They give a walkover. It is the meniscus tear. If the meniscus is torn, it becomes so painful that it is impossible for the person to put any weight. It is this meniscus tear, and which requires surgical intervention. That means you have to open it and you have to really repair it. After repair, well, now because with the endoscope you can repair it. You don't have to really split open the entire.
These small incisions.
Very small incisions, but yes, still it is surgical. So these meniscus, which we'll be discussing at length, that how they are like C-shaped, they are like this. And then from side, if you see, that they are like wedge, they are like this. So this is the point where I'll be telling you that you need to understand it, right? कि कैसे होगा? I'll show you. We'll be using that plaster of Paris, right? वो खेलने के लिए जो plasters use करते हैं. We'll be using it. We'll also be using it when we'll be discussing the embryology. So in embryology, during that discussion, we'll make that this is one blastula, and then let's form the layers. Then as this one layer penetrates, so that way you'll get the complete 3D visualization of how it forms, because it is important for you to understand the embryology so that you understand congenital anomalies properly. So when we'll be making the heart, so we'll put the one camera over here, right? And then we'll make it. Acha. So here, this is also very similar, right? So when I say wedge, this is the front view, this is the top view. It requires a bit of imagination, right? So it is not the flat structure, right? If it is C-shaped, but this part of the C is thick and this part of the C is thin, right? So it is exactly like this. So thick and it goes like this. So this is to adjust the level of the bones, right? So that will come. No doubt, even right now, if there is any confusion, not to worry. But remember, these are the intra-articular. Intra means inside. Intra-articular discs, right? They are called as the meniscus. Yeah, they are called as meniscus. N-E-N-I. Either there is some issue in the control key. So this is another a bit of layout. One bone, second bone, and covered by this fibrous capsule. And in between there is synovial membrane, right? This is the synovial membrane which is covering, right? So this is the synovial membrane inside this synovial membrane. So that means there are two layers. One is the inside is the synovial membrane, and then it is covered by this fibrous capsule, which is outside. In synovial membrane, there are cells. These cells, they secrete the fluid, and this fluid is like oil. That's why we say that it is the oil. Oil means it is for lubrication. Right? It is for lubrication. It is a viscous. Viscous means it is a thick fluid. That it is not a watery fluid. It is reasonably thick fluid. And it consists of hyaluronic acid, large amount of hyaluronic acid. And this hyaluronic acid, which is for lubrication, it is for nutrition. So that's how it really goes. And this synovial fluid is absorbed and formed again and again and again. It keeps on happening. So this is also a live thing. So on to the synovial joint, there are some plain synovial joint. Plain means they are just gliding. These are the areas which are gliding over each other. Right? Sutures also means stitches. Yes, that's right. Sutures also means stitches. So this is plain or gliding. Second, when we'll be discussing these synovial joints from the angle perspective, as synovial joint is the most important joint, we'll be understanding it from axis. Axis means this is one bone, this is another bone. If the bones are moving like this only, so that means it is only working on one axis. Right? There is flexion, there is extension. So that means this will be the axis. Right? Because on this axis, the movement is occurring. Right? Maybe, yes, that's right. A hinge joint sort of thing. That's right. So there is one axis, but then there can be biaxial. There can be multi-axial. So biaxial means there will be two axes. Two axis means, say, for example, condylar or ellipsoid joint. Condylar joint, condyle is the big structure. So this is one movement is there, but then there can be some side-to-side movement also. It is not necessary that both the movements will be of the same scale. Whatever this much is moving, the side-to-side movement will also be that much, not necessarily. But there will be movement on two axes. Similarly, ellipsoid, right? Especially our fingers. And then comes the multi-axial joint. Multi-axial joint is, say, when it really moves like a saddle joint and ball and socket type of joint. We'll see example of all of them now. Let's start with plain, right? In last batch, someone gave the name Bonnie Kapoor. As such, it is difficult to remember that how many plain joints are there. So that's why this image was created. Right? So here, within seconds, you'll be able to know that, okay, this is the skull, this is neck, and then this one is scapula, correct? That one is scapula. And this one is scapula, this one is clavicle. Right? So this one is scapula, that one is clavicle. So that joint is acromioclavicular joint. So all of you know this. So that is done. Right? Same way on the opposite side. Then we have got articulation. These are the vertebrae, right? Vertebrae, they articulate with each other. This is really painful. So this is articulation. We are talking about the vertebra. So here is one vertebra, here is another vertebra, right? Transverse processes. And in between, there is intervertebral discs, correct? But these vertebrae, they also join with each other by the superior articular facet and the inferior articular facet. It means what? That these vertebrae, this is only just in between, but as such, the full body, right, and the second body, right, they are into contact with each other. So thus, even the vertebra to vertebra, they are connected with each other. So that is what is called as the superior articulation and the inferior articulation. So that is again a plane gliding, right? So that's why they just glide. So this is done. The third one is intercarpal. Intercarpal. Easy to understand, right? All those 8 carpals into the wrist. So those 8 carpals, they are along with each other, and they are not forming any, say, concave big surfaces. They just glide over each other, right? So this is the intercarpal. Then carpo metacarpal. So this is what is called as the joint between carpal and metacarpal. Metacarpals, you remember, they form the palm.
Yes.
So carpo metacarpals, these are the, again, the plane type. Then similarly, this is sacrum. This is sacrum. The hip bone is made up of 3 bones: ilium, ischium, and pubis, right? So where you put your, if you stand in style, so then this ridge, that is the ilium, right? Or the iliac crest. This is the iliac crest. Ischium, on which is on the posterior side, on which the person sits, and pubis. This is the central area, right, where the 2 pubic bones meet, and this is called as the pubic symphysis in the bones. Now, this whole pelvis is connected with sacrum. So sacrum is connected with this iliac, and that's why it is called as the sacroiliac joint. Sacroiliac joint, as there is very less movement, but it just slides flat. The way it was in upper limb is the same way it is in lower limb. So we have got the intertarsal, that is one, and tarsometatarsal, that is again over here. So all of these are plane or the gliding joint. Plus cricothyroid and cricoarytenoid. Right now, not to be worrying much about it. Just remember, these are some of the very crucial things for our larynx and pharynx. Right? Cricoarytenoid, one of the major components for our voice production. So they should just slide. There should not be any complication. They should be able to glide very fast. So, and their size is very small. So the muscles are also very small, but it is a fine precision movement which then leads to generation of the sound. So that is one. On to the second type, which is called as the hinge joint. And hinge joint in which there is only one axis. There is one axis. On one axis, the things are happening. So here it is our humerus, and that one is ulna. So here there is a pulley-like thing. So that's why in the transverse plane, right? Then because if we are standing straight, so then line which will be passing through our elbow, that would be the transverse plane, right? And then there'll be flexion and extension. So flexion and extension, right? So flexion and extension, but the plane which will be passing, that would be like this. Correct. Ellipsoid and condyle, yes, it is coming. Just hold on. So this is like pulley, right? So this is flexion and extension. Hinge joint, just one joint, right? Comes the cervical. In cervical, there is C1 is called as atlas and C2 is called as axis, and axis because of this
Dense.
just which is called as the dens. Right? So that's why it is called as axis. On axis, everything moves. So this is also a uniaxial joint. Uniaxial joint, that is, there will be one axis. This is between atlas and axis. So that's why we'll be calling it atlantoaxial joint, right? Atlantoaxial joint. So in atlantoaxial joint, it is the C2 which is giving the dens and C1 which will be rotating on it, right? This joint is used to say no. So whenever you move, so remember it like this is fixed, the head is moving like this, side to side. So this is the joint which is used to say no, right? Makes sense? Because that axis, so in this case, axis would be which? What will be the axis? When you're telling no, what would be the axis? On the axis? On which?
C2.
It will be vertical axis, right?
Yes, vertical.
So things will move like this, right? So vertical axis. That is. Oh, ये लिखा ही था यहाँ पर.
Sir.
हाँ, बोलो.
No, won't it be horizontal axis?
No. How can horizontal? Horizontal तो ये हुआ ना. Horizontal plane ये हुआ. If this is the plane, so if this is the plane, then the movement would be like this. So when you will be bowling, हाँ बोलेंगे, then that would be the horizontal. Axis मतलब क्या? Around which it moves. So if this is the long axis, when you say no, so if this is the nose, then nose it moves like this now. So this is the no. Right? No. That is the vertical axis. Got it? Acha. Atlanto-occipital joint. So atlas is one. Occipital is that bone, right? This bone. So there would be a joint between occipital bone and the first, that is C1. So that is called as the atlanto-occipital. We know that no is said by the joint which is between C1 and C2. And yes, it is said by the joint which is between occipital bone and the C1. That is called as the atlanto-occipital. Now, very easy, no? Very easy. That ring is there and the entire head, right? It is moving like this. Which axis? The axis passing is like this. So this axis, that is the horizontal axis.
Horizontal.
Right. Perfect. On to the biaxial. So till this point of time, right? अब कभी अपना सर टेढ़ा भी करते हैं, right? टेढ़ा भी करते हैं, right? So that goes, but there is a limited movement. We can't make sir absolutely टेढ़ा. Now we come to the biaxial movement. Achha. Many of the movements, they are mixed movements. In the human body, things are mixed movement. So that point we'll just talk about in a minute. Biaxial, two axis, clear two axis. And you'll be doing this thing right now. The condylar, right? The condylar movement. In the condylar movement, we'll be taking the example of femur and tibia, right? Femur and tibia. So those are the big condyles, big rounded surfaces, they are condyles, and that is what is making the knee joint. We'll say transverse axis. Yes, transverse axis, because leg is there. So you flex straight, right? Flexion, extension. So it is the transverse axis. Flexion, extension, right? And that is the transverse axis. But there is one more movement. Flex your knees to 90 degrees. अभी बैठे हैं तो 90 degree पे होगा. And then that's your toe, right? That's your foot. Consider that's your foot. Try to move the foot medially, laterally. Can you? Without changing the flexion. Keep the flexion as it is. I mean, this is what I mean to say. This is your right?
Partial rotation.
So partial. So this is what we are moving, right? This 90 degree flexion is fixed. Correct? So yes, you can. So when we are moving it in, out, which axis are we dealing? It is going like this. So that means axis will be like this.
Vertical.
Vertical axis. That's right. So that would be the vertical axis, where then will be the partial rotation of medial and lateral. Same way when we'll be talking about TM joint, very vital joint, this joint, right? And if you want to feel the TM joint or the temporomandibular joint, temporo means temporal bone, mandible is mandible. So temporomandible, which is meeting at this point, just touch where your ear is, right? Just behind the ear, and open and close, right? First do the open close delicately, then do it with power and see the movement of the bone. how extensive and how powerful the movement is.
Yes.
You feel it because you'll be able to, it is gliding, you'll be able to feel it very prominently because there is a condyle, right, which moves. So it will be moving and you'll be able to feel that. That's why TM joint is amazing joint. Right? We'll be spending one full lecture only on TM joint. The second one, now comes the difference, right? Another type is ellipsoid. Ellipsoid is when there is flexion, extension, and there is abduction, adduction both. And both the things, they are occurring very conveniently. Say in your elbow, flexion, extension, and even the medial rotation, lateral rotation, right? That is also, it can be done easily. Abduction, adduction, that can also be done. So over here, the ellipsoid type, it occurs like this. Right? What are the examples? Say metacarpophalangeal joint, right? Metacarpophalangeal joint. Metacarpophalangeal. Where is it? Metacarpophalangeal. Metacarpals, and these are phalanx. Right? So that means all
between them.
Yes, between finger joints, right? So that's why finger joints. So you get this when you do abduction, adduction, flexion, extension. Both the things are done powerfully, right? So dual axis, and they are working properly. The wrist, side to side, flexion, extension. Both the things, they are done properly. Then atlanto-occipital joint, right? That head tilt, right? So that Pankaj Tripathi or Ajay Devgan, right? So that is all they are using, that atlanto-occipital joint on its lateral side, one side, right? So that is what is called as the head tilt. Then comes the saddle joint. Saddle means on horse, right? So this is the surface which is concavo-convex. Concavo-convex. It is a reciprocal surface. If one is concave, second is concave, convex. It is like this, then second is like this. If this one is like this, then second surface will be like this. Right? So they both go reciprocal to each other. So that is concavo-convex. Now here we have to understand this one principle, which is the only principle which is bit complex. What it really tells is that in case of saddle joint, you can have two types of movements. One, what is called as the conjunct rotation, and second is called as the adjunct rotation. And both these movements, they occur together, one after the another. One after the another, they occur. But in one full movement, both of them, they'll be taking part. Importance is during injury. Importance is during arthritis. When certain movements, importance is when there is some bone is broken and you want to tell someone that don't do this movement or do these movements. So especially during the sports injury. So here it is. Understand it very properly. We'll be taking the example of knee joint. Now, on YouTube lecture, I took another example, but over here I'll be taking knee joint, as very soon we'll be discussing the knee joint at length. You can do flexion and extension of knee joint easily. Even right now, you can do it. So that is easy, flexion and extension. Now you understand this. When you are right now into flexion state, right? So your knees are 90 degrees, you are sitting. As you try to raise your knee and so that it becomes straight, in the last 20 to 30 degrees, tibia rotates laterally. So here is, if you consider this is the femur, right? And this one is tibia. So as we try to extend this tibia, it rotates externally. Tibia rotates externally or laterally in the last 20 to 30 seconds of extension. And similarly, from this point, when you want to flex, the first tibia will rotate slightly and then the flexion would start. This is automatic. We see that, okay, only flexion and extension. No, that is fine. But the tibia is rotating. Tibia is rotating laterally and medially and along with the entire leg. So thus this is called as the conjunct movement or the conjunct rotation, in which the normal flexion extension is occurring, but there is some other movement which is also occurring and it cannot be prevented. It cannot be prevented. So that is what is called as the conjunct. Conjunct means together, in sequence, in continuous flow, right? You don't have to really tell, okay, now the flexion of tibia is over. Now the internal rotation will start or the external rotation would start. No, nothing. It is continuous flow. Right? When we talk about adjunct is independent. It has got nothing to do with anyone else. So here in knee only, when the knee is 90% flexed, and now you take the tibia and you move medially, you move laterally, you'll find that it has got nothing to do with the femur, knee joint. Though movements are occurring at knee joint, because you know that when the toes they are going in and out, but it is without involvement of any other joint. So that is called as the adjunct. In one joint only, till certain degree there is conjunct, and after that there can be adjunct depending upon the region. So I was talking about that in music also. It is actually like this. In music, there are two types of notes: conjunct motion and disjunct motion. The way it is that right, Saragama Padanisa, when it goes, or C D E F G English letter. So over here, when these are close to each other, right, there is not a difference of more than half note. So then that is called as the conjunct motion. So this is what also called as the one scale degree. One scale degree, this is very easy to sing, especially say, for example, in Titanic, My Heart Will Go On, right? So if you try to sing that song, you'll find that it is very convenient, very easy, right? Even when you'll try to play, you'll find that all the notes, right, they are very next to each other. You'll be able to play it very easily, except the chords. Chords are a bit complex, but you'll be very comfortable in singing this. In competition, in all this, say, singing competition, right? In on some of the songs, right, as a public तो अपने देखते हैं कि अरे वाह वाह क्या गाया. Those judges would say कि नहीं कि this note was not okay, and then they say okay, can you sing one more song, and then judge would give the second song. So what are they doing? They are using disjunct songs. Disjunct songs means in which there is a big jump from one octave to another octave. Say, for example, Kishore Kumar, Lata Mangeshkar, right? They were considered as the superb experts in this, even Muhammad Rafi. Now, those things you will find that why it happens that पुराने song अभी भी सुनते हैं and आज से सिर्फ एक साल पहले का song पता नहीं कहाँ चला गया. Why it happens that we keep on listening to some songs which are so old, and at that time technology was not that high, right? And in all these music competitions, they pick up all those old songs because those songs they were very difficult to sing. But at the same time, when it is said that those songs they were based on those rag which are like meditative effect, so you'll not be bored by listening to those songs. Baki any of the song, even if you're a die-hard fan of Michael Jackson, but you keep on listening to Billie Jean, so remember the time once, twice, thrice, but चौथी बार तो फिर वो क्या बस, right? All those heavy electric guitars, etc. You try to listen to those English songs at night. नींद ही नहीं आएगी 2-3 बजे तक because they generate so much of adrenaline. That's true. Finally, this is ball and socket, that is spheroidal. So there is easiest to understand. Globular head, right? And then there is a cup. So that head goes inside and then the movement of spheroidal. So shoulder joint, hip joint, no doubt. Hip joint, shoulder joint, but you know the difference between both of them, right? One is for mobility and second is for stability. So you know that thing very well. But they are collectively called as the ball and socket or the spheroidal joints. So this is what we actually discussed. This is like a brain map. brain map. And this was the homework. आज के लिए अब ये होगा homework. Homework is you revise this entire file and at the end try to write everything. It will make a big difference. बहुत फर्क पड़ेगा. Especially during our few next sessions when we'll be discussing the pathology, when I'll be showing you the x-rays, when I'll be showing you the CT scan and MRI of these joints. So you'll be able to understand them at a very fast pace. So let's see this. Very easy, right? So the CL is classification. So based on the structure, whether it was fibrous in that it was, we talked about suture, then there were various type of suture, then syndesmosis, then gomphosis, clear? Then in cartilage, there was primary and secondary. And then you say primary, that was, and synovial. In synovial, it was like plane, hinge, pivot. This was one axis, second axis, where it was condylar and ellipsoid, and multi-axial is saddle and ball and socket. From function wise, whether there is no movement or there is slight movement or it is a freely movable. Regional, easily skull, vertebra, limbs, and number of bones. When we say this is the simple, this is the complex, right? Compound. And then third one was the complex. In complex, the keyword was that it is having intra-articular disc. Intra, that was the keyword, intra-articular disc. You try to make it more rich by adding those examples, figures, images, right? So this particular topic, try to make even it more rich with the images, with the points which you like to add, do that, right? So that would be like a homework. All right. So thank you so much.
Sir, that link problem.
Bolo.
That link couldn't be open. I tried so much time.
Wait. Please solve it right now.
Sir, now this PDF will be available, right? Joints.
Just a minute. Let me put it right now.
Okay, sir.
And just let me know. अभी के अभी देखते हैं. Okay, it is uploading. Uploaded. Done. Do you see it? It is day 9.
Yes, sir, it's there. Yes, joints PDF.
Yes, sir, it's there.
Anyone who is not getting it?
Sir? Sir, I have a doubt.
Bolo.
What is meant by conjunctivitis?
Itis is inflammation. Correct?
Okay.
Tonsillitis, appendicitis, laryngitis, pharyngitis, inflammation.
Due to some infection.
Correct. And due to infection, or it could be because of injury.
Okay.
So
Yes,
conjunctiva is that the outer layer. So whenever there is inflammation, the sign of inflammation, one of the sign is redness. So that is when we say red eye. Right? Redness. Then there would be inflammation. That is when the fluid gets collected, and then there would be loss of function. And then there would be pain. These are the 4 cardinal signs of inflammation.
So conjunctivitis means inflammation in eye, right?
Eyes. Red eye.
Red eye.
Red eye.
Okay, sir. Thank you.
So everyone is getting that file. Is it over there?
Yes, sir.
Yes,
Yes, sir.
Anyone who is unable to access it?
No, sir.
It is there or not?
It is there, sir.
It is there, sir.
It is
It
there.
is there, sir.
Okay.
It's not open. Yeah, so the link problem.
Wait. Radhika, na?
Yeah, sir.
Radhika, send a mail.
Okay, sir.
Just send a mail. I'm sending you the link right now. Let's settle it. Manage access. And in case if you are not getting it, so I'll send you the link of directly that general anatomy folder. Just let me. Jonathan, I actually wanted your second opinion CT scan of. You can definitely send. Send it.
Sir, I'm unable to find today's PDF.
Yes. Oh. Again, I missed you.
I can see the previous PDFs which you already uploaded.
Previous PDFs you can watch, no? And how about today's PDF? Is it there?
No, that I can't see. I just opened the file folder.
That is not there. Just refresh it. Surely you'll be getting it. Or just scroll down in case if it is. Because it is there. Everyone is getting, so there is no problem. And we have got enough storage over here. It is in terabytes. So Radhika, have you sent the mail? Just send it till mbbs@gmail.com.
Yes, sir. I sent the mail about the link.
Is your email address that Harshvardhan? The link has been sent to bolo. Go ahead.
Sir, the last session on radiology is uploaded on YouTube. Because I have missed that lecture. I was at passport office.
Okay. That lecture is there on YouTube, but it is not into that playlist. The playlist is different, but it is there. I'll just find out because same question has been asked by many. So I'll just find out the link and send it across. Or you can just search onto our X-ray chest, you'll come across.
Okay,
so for the lectures I've missed, I can clear them up from YouTube, right?
Yes, bilkul.
And if I have any doubts, I'll come.
Definitely. Okay, see, I have sent the link to 2 persons, right? Maybe the email address is different as compared to the name. But have you got it? I've sent the mail to Sanskar and Harshvardhan.
No, sir, I can't get it.
Radhika, I am unable to see your any email. Wait.
Found the PDF.
Sir, I can send you my email ID on the chat section.
Acha, in the chat. Arey dost.
No, I just send a mail, but I can send that my email ID on the chat section. Okay, wait, so I just.
Aryan, I am able to see every PDF note still today. Good. Sanskar, you got it. Fine. PPT is not opening. No. This PPT was made in our normal PowerPoint only. Nothing, no special app is needed. You got the PowerPoint, right? The latest version. This is PowerPoint 360.
Yes, sir.
So it is opening.
Sir, in case of trochlea, is it hinge-like?
Trochlea is hinge. 27 messages. Wait, let me join the icon.
Sir, I don't have any problem regarding drive, so can I do it?
Sure. Bilkul. No problem. Bilkul. See you.
Thank you, sir.
Day after tomorrow. That's right. In primary cartilages, the yellow color will be prominent. Synostosis.
Excuse me.
हाँ बोलो.
I have sent an email to you, so please check that. I want the link again.
Shravani?
Yes, sir.
Yes. Sent.
Okay, sir. Thank you.
Ayan. Sent.
Okay, sir.
Got it?
Still no, but I will. Yes, sir. I've got that. Thank you.
Yeah. Okay, congenital diaphragmatic hernia. Surgery was when 2 weeks old. See, for any of the genetic thing, any of the complications or any of the, when that we are discussing any of the disease, I won't be taking name anytime, right? So in general, there is, whenever there is any of the disease, something which is related to congenital thing, then one needs to go for what's called as the karyotyping. Because in thyroid, something like Hashimoto disease, then some autoimmune disorders, rheumatoid arthritis, right? Many of the conditions, if they are occurring in early age, the chances of it being congenital, they are very high. So, पता है कुंडली मिलाते हैं कुंडली.
Yes, sir.
Instead of that, this karyotyping is far more important. No one does that. That's a different thing. Tonsils. The gentleman who has sent this message, issue related tonsils, stones, send me a detailed mail. Nodding movement. Yes, that is yes. That is yes movement. That's right, Lavya. Nafiz, I'll send you my address to you. अब आपके फादर ने इतनी अफलातून स्वीट्स लाए हैं एंड यू आर नॉट ईटिंग तो मुझे भिजवा देंगे. अरे खा लो यार, थोड़ा दौड़ लेना. इट्स ओके, वंस इन अ व्हाइल चलता है. Sparsh, ask them to try to open with another browser. Yeah, this is also good. I'm using Edge and on my Mac, I'm using Safari. But yes, you can try it opening onto the other browser in case if it is not opening. I'm trying to open, say, downloads. PowerPoint, Aryan, PowerPoint. अभिजीत भगवान से प्रार्थना करना ये ना नंबर नीचे जाए, right? If the number drops, so then we don't have any other option but to stop the lecture. And मैं seriously बोल रहा हूँ.
Because 200 से तो अभी almost 150 180 तक आ गया.
आज 180 तक
आज
थे.
180 था. हाँ.
But yes, that is true. मतलब last time हमने patience रखी थी. We till 25 तक गए तो wait किया. Message was sent to everyone, but then people said कि अभी इतना क्या पढ़ना, this that all सब तरह के excuse थे. और कहते पास तो हो ही जाते हैं ना. उसके बाद फिर there was no other option but to close.
सर तो भी if अगर क्लासेस आपके कंटिन्यू करने रहेंगे तो फिर आपको कैसे अप्रोच करेंगे? इफ विश्वा के थ्रू तो आप फिर ये कर दोगे ना, बंद कर दोगे अगर काउंट लो.
लास्ट टाइम वही हुआ था. ये इनफैक्ट दोस्त पिछले 4 साल से ये हो रहा है. मैं हर बार बोलता हूँ आई एम नॉट अगेंस्ट द सीनियर्स, बट कई बार वो ऐसा बोलते हैं कि क्यों इतना पढ़ना. मेरे पास इवन ऐसे हेट मेल्स भी आते हैं. भाई जस्ट आराम से पढ़ता हूँ, बट यस कुछ भी लिखते हैं. अभी भी आते हैं. और एक दो नहीं.
Sir,
हम्म.
can I ask you a question like it is about noodles?
हाँ बोलो बोलो, इसमें फॉर्मेलिटी क्या है, आराम से पूछो.
Sir, after eating noodles, what should we do? Because it is made up of maida, right?
हाँ.
So after eating noodles, because it gets packed into our intestines, what should we do? Clear all the mess inside our body.
बस पहले भगवान से प्रार्थना कि आपके नेक्स्ट टाइम मैं नहीं खाऊंगी, इस बार खा लिया तो खा लिया.
Sir, I'm eating after 2 months. So, I'm asking you.
देखो, जितना शरीफ होके मैं बोलता हूँ ना, राइट, डोंट ईट शुगर एंड डोंट ईट दैट, बस मुझे तो कोई खाने पे नहीं बुलाता, बिकॉज आई लव पूरन पूरी, आई लव लड्डू, मतलब वो खत्म. बट देन एट द सेम टाइम, मतलब से फॉर एग्जांपल इट compensate it with each other things. You have sprouts, you have those saute vegetables, so then that thing gets cleaned up. पर ऐसे कोई जीना थोड़ा ना छोड़ देना है. मतलब जब बोला कि शुगर नहीं तो मतलब इतनी ज्यादा नहीं. बाकी कभी नूडल्स का मन हो तो डेफिनेटली खाओ, कभी लाइफ है.
Yes, sir. Everything is favorite.
Noodles?
Noodles are your favorite or puran puri?
Saute vegetable.
Saute vegetable.
Sir, always puran poli.
हाँ, ये कौन है? कौन है?
Sir, both.
मेरा दोस्त कौन निकला? अच्छा, चलो
Sir, for me it's vada pav.
वड़ा पाव तो यार नहीं. कभी कभी ठीक है.
So I send my mail ID in the chat section.
Sir, if the number drops, then you will take private classes.
हाँ, पर मेरी इच्छा हमेशा ये होती है कि as far as possible ना.
हाँ.
ठीक है, मतलब प्राइवेट क्लास में क्या वो बात पूरी अलग हो जाती है फिर. इट इज, हाँ, अनलेस यू आर सीरियसली थिंकिंग ऑफ USMLE और वो सब करना है, एंड दोस पर्सनल ट्रेनिंग्स दे आर वेरी रिगरस, वेरी रिगरस. राधिका, आपकी मेल नहीं आई? एनीवे, नो प्रॉब्लम.
So I send my mail ID in the chat section.
हाँ, वो आई एम सेंडिंग इट.
Okay, sir.
Sir?
हाँ, बोलो.
Sir, what fees do you take for private classes for USMLE and lab coaching?
I'll send you the details.
Yes, sir, sure.
It is because it is not only the plab, etc. It is like right from the motivation to exercise to your diet. I always say that it is impossible when if someone is physically not fit and then planning to go for the big things. No, it never happens.
Okay, sir. Please share me the details as soon as possible.
Just a minute. Radhika, RADHIK. Okay. Radhika, just check it.
Sir?
Mm-hmm.
Actually, Shravani means I asked about USMLE.
Got it, sir. Thank you.
Got it. All right.
Yes, sir.
Jonathan, this is sebaceous cyst. There is a fluid-filled cyst. This is into the axillary region. Now this is quite deep. Yes, you might have to go for because this thing won't resolve by itself. It is to be removed. But because only few layers are there, it won't be causing any complication. It won't be causing any complication. This is what's a bit blurred. 4.1. Is there any history of injury? Just let me know, right, if there is any history of injury or not. Okay, yes, a plan. Okay. Aisha. Okay, so I think I have answered almost all of them. Regarding any of the cosmetic thing, right? If the nose is big or this, any of those things, it is again a relative thing. So no need to go for any of the cosmetic surgery.
Sir, I've asked a question in chat.
Urula. Chat, so there are 18. Okay, thank you. हाँ यश बंद नहीं कर रहे लेक्चर. Men are from Mars. अभी लिख रहे. Well, I'll send it. Sure. Regarding these government sites, etc., I don't have much of the idea. Don't have much of the idea. See, these lectures, they were planned with that intention only. Because once you'll go abroad, you'll find that the speed at which they go through all those basics, because what everyone feels is कि basic में क्यों time खराब करना, while we spend about 2.5 months just for the basics, and then we pick up. So होता क्या है, by the time जब basic खत्म हुआ, then we'll be taking the physiology. The highest batch which reached was till neurology तक पहुंचे, and then the number dropped pathetically, so we had to stop. भी देखो ना पहले दिन पे मतलब कितने थे, there were like 470 जितने थे. The number has already dropped. Lavya, so have I sent you the link? If not, I'll send you right now. Are you there? Anyway, let me send you. Send. Okay, so I think we finish for today and see you day after tomorrow with the next topic. Take care.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Bye, sir.
Thank you, sir. Bye, sir.
Bye.
Bye, sir.
Thank you, sir.
Most welcome.